Today's declaration from the mayor comes as monkeypox continues to spread in our city. There are now over 1,400 cases in the 5 boroughs, which makes up about a quarter of all the cases nationwide.
Fox 5's Chris Welsh is joining us live outside the Chelsea Sexual Health Clinic in Manhattan, which is one of the locations that has been designated now as a monkeypox vaccine site. Chris.
Yeah, Lori and Teresa, today's declaration from the mayor gives him the power to basically suspend city laws, all in an effort to help try to contain this monkeypox outbreak. But some fear it may be too late to adequately contain it.
Oh, no, drop the ball.
Mayor Eric Adams laughing off the criticism that New York City may have dropped the ball when it comes to getting ahead of the monkeypox outbreak.
No, we're not dropping the ball. We have the ball and we want the ball and we have it in our hands.
His comments coming Monday morning, just minutes before the city officially declared monkeypox a state of emergency. It's a move that gives the mayor the authority to suspend local laws. Former Mayor Bill de Blasio did the same at the beginning of New York's COVID peak in March of 2020.
It's not going away.
2 years later, we can likely say the same about monkeypox, which, as of Monday, is now presumed to have infected more than 1,400 people here in the city. And most health experts believe that figure is a vast undercount.
There are things that the city could do to strengthen its response.
Epidemiologist Dr. Jay Varma, who worked under the de Blasio administration, says what the current mayor could do, since the virus has been transmitting among men who have sex with men, is reopen the city-run sexual health clinics that have been closed since COVID. According to reports, only 4 out of 8 are currently operating in full. But Varma says the biggest mistakes so far in regard to monkeypox happened at the federal level.
You know, if there was any infectious disease that the country was well prepared to fight against, it would have been monkeypox. There were vaccines, there were tests, there was even a drug that the U.S. government helped develop that was available, and the response was delayed.
Now, the demand for vaccines still far outpaces the supply. But on that note, the city does expect to be getting in the coming weeks somewhere in the neighborhood of 80,000 new doses. But we have asked repeatedly today when those appointments might open up, when the doses might actually be available to New York City residents. And so far, the city health department not commenting.